So we have been promulgating the idea of VistA and the EHR, and promulgating it because we have felt as physicians and clinicians that it was our record, and that we thus wanted to move ahead in any way we could. I think that little mic come back. I almost ought to talk about this fast before it goes away. And so the culture that has put the VistA on the map, and it's really on the world map, was based on clinicians and programmers working tightly together virtually every day. Every night I would walk down the hall and run in and see the programmers and see what they had come up with from my comments of the night before. So it was rapid turnaround, rapid cycle, iterative, incremental, and built some beautiful software that currently is as user-friendly as any software that exists, and people still love it. Interns and residents walk into my hospital, and within a day they are enthralled and want to use it. Even those that have come from systems that have fairly good records, they like VistA, they like using it. And I continue to like using it and like it very much. I was just saying, just in the last 2 or 3 weeks, there must have been 7 or 8 groups coming to my hospital to hear about VistA. Now they're hearing about a lot of other new things as well, but VistA is what they're looking at, and they're really surprised. Even fairly seasoned VistA users suddenly say, well, you know, you can't do this and can't do this. I said, what do you mean you can't do this? Look at what you can do. And all of a sudden these graphs appear on the screen very fast and very quick, and comparisons are very easy to pull up with the graphic program in VistA, and we're just talking informally that no other system can compare stuff like we can compare so quickly and so fast and so well. And it's kind of hidden, because the things that make VistA great, I gave a talk on meaningful use for the, try to get that back again. For meaningful use at the American College of Healthcare Executives. And they were very impressed with what we were able to show. But we were showing straightforward VistA and what would be coming down the line in the future. And one of the slides I had was critical features of VistA that make it great. None of them were listed in meaningful use criteria. Images with text, that's not meaningful use. The one record for one patient, whether it's inpatient, outpatient, all combined, that's not in meaningful use. And as a matter of fact, it's not in play in many places, but it's really critical, makes things happen. The remote views that are so easy to get in VistA, you can see everything that's happened in San Francisco or the DOD or many other places, all on the same record. So we are really very lucky. And one of the questions is, have we lost our edge in help of the providers helping the programmers develop? Well, one thing that has happened, and I want to let you know about, I just came from the Chief of Staff's meeting. I happen to be the Chief of Staff at my hospital. And needless to say, there was a number of demonstrations at that meeting, and one of them was Neil Evans, who has developed enormously fun things with the iPad. And I want to show a little bit of that to you so that you can get a flavor of this, because again, it's rapid turnaround. He gets with a group of programmers and 2 or 3 other people that are providers, and they develop one thing after another, and the ideas get going faster and faster, and pretty soon he's got applications that everyone would enjoy. The thing that you're looking at right now is what was called the Enterprise App Store. Now, we were told by Apple that App Store was verboten. We could not use that term. So it's, I think, going to be called the App Library or the Launchpad, and I'll show you that. But these are things that we can download and that we use. We've got a patient viewer. The MVision thing is we can see all the EKGs anywhere in the hospital, and that's another grant. There are about 4 or 5 innovative grants that were let out to VAs across the country, and 2 of them came to our place. And one of them was that, and the other one was the patient viewer. that Dr. Evans ran. And you'll see on there that there's Citrix. And Citrix is just a wonderful thing because any Apple, any Windows version can use Citrix to download and see your record in your hospital by thin client. Nothing comes to the machine. You see it just exactly like it was in the hospital, even if you're looking at an iPad. This is hugely valuable. Anywhere I am able to look at it. And so that's a step forward. These are steps forward. We are, and all we have to do is say we want it, we need it, and suddenly we take away all of the funny business that we used to use with straight VPN access and our laptops that were exactly like hospital systems, and now we're using them on this much more simplified system. So I'm going to back off, and you can see that there are several things. The Launchpad does show you that in the very near future, in fact, even now, journaling by patients, PTSD, a program developed a couple of years ago and actually got on iTunes and has been downloaded in Europe and other things, developed by the VA, an app for secure messaging, an app for prescription refill, an app for notifications, health assessment. At some point, we'll be doing appointment development. We have something like 15 suites of things that are being developed along with the patient viewer, which I'll show you in a moment, which can be given to a patient. Now, the patient has control of all of these things and can do all of these things. And in a year, a short year, all of this can be developed through these single individual systems that are standardized and work together. Well, it sounds a little like what we were doing in the past, and it is a lot like what we're doing in the past, and it's got the physicians very excited, and they're moving very quickly on it. The viewer in demo form looks like this, and you can see that Aldi Smith is easy to visualize. We actually, for the regular app, they haven't given us the ability to get the picture yet, but we're working on it, and we'll get that in that same spot. But all the demographics are available. This, by the way, is a dummy patient, in case you're wondering. Problems are there, allergies are there, the outpatient medications are there. If I click prescriptions, I can see all of them that are here. If I click any one of them, I'm immediately downloading anything that has come down from the regular system. So this is the system coming down live to this system. And if I go to like, trying to find a abnormal one, but if I go to any of the hemoglobin values, I now see them in a graphic format, and if I want to visualize what they are, I can just move that across the cursor anywhere. And of course, the patient or the doctor, for that matter, this was not obviously a wise one, can, that was probably a slip, not the patient, but the patient can see if he's outside of this tan zone, it is either too high or too low. So it becomes very easy, very intuitive for anybody to see. And if I want to look at the medications the patient's on, I can do that as well. And I can see where the medications are that are now being given versus those that have been given in the past and have been stopped. So it makes it very simple and very easy to look at the system as you can see. The current patient viewer that we are going, which is summary of care that we're giving to caregivers and their patients, and will basically be giving it to the patient. It's going to be kind of simple. Here I can look up any patient in my hospital or any patients on CPRS. The patient will be given a key that will allow him to only see himself. But he'll be able to see it very much like you are looking at it now. And with My Healthy Vet, which I was one of the early members to devise what the requirements were, we put in all kinds of things so that the patient could see the whole record. So the providers need to be part of this business, but so also do the patients need to be part of this business. And when it becomes the patient's record, they will drive innovation as well. And they will drive how to do things easier. My Healthy Vet, for instance, the patient has to put the blood pressure in, then he comes out and goes into another thing and puts the weight in. And my patients have said, why can't I put them all on one screen? All right, with the next app to put that kind of stuff in, that will be all on one screen, just like the patient wants it. And then they can see the graphic picture of his blood pressure, the graphic picture of the weight across the screen as well. So I'm going to, one of the things that I was asked about is what happens to the legacy data. I think the legacy data will be preserved. It is easier and easier to dive into and see, and is very, very important and very valuable. May 22nd circulation, Dr. Kolodner is on a paper that I put together with a lot of other people, where we dropped down some 53 million blood pressures. Actually, the whole vital sign package on about 53 million times on 1.5 million patients, and found over 500,000 patients who were hypertensive as defined by the fact that the blood pressure was above 140 over 93 separate days. And we looked to see when it returned to normal. And in the year 2000, this is a whole decade worth of information. Just think of what we were able to do. The control was 45%. In the year 2010, the control is 75%. We have greatly improved the ability to care for patients. And while certain things about these records intrigued a lot of us, this point is what the authors or what the editors in circulation wanted to see most, and is the most dramatic thing. Another thing that's fairly dramatic is that every winter the control gets better, and every summer it gets worse, and every winter it gets better, and every summer it gets worse. And this wavy line goes for the whole 10 years, cycling every year. And it's about 7% difference, and the reason why it's 7% difference is if you look at the blood pressure variation in the hypertensive group, it's twice as much as the blood pressure variation in normals. So control of hypertensives will be very much more affected by seasonal variation of blood pressure, and that's what we produced with this kind of data. We will be able to mine data. VistA is coming along where you can actually go into the data warehouse in Austin where all of this exists. It gets updated virtually on a daily basis, and I think it will continue to be a very valuable resource for taking care of patients. Thank you very much.